Welcome back to the Clear Aligner TMJ podcast. Here with Nick, Mason, and of course Dr. Hale. Welcome. Thanks for being here today. So I guess today we're going to be kind of diving more into the clear aligner. I know last time we talked kind of more of a general basis of like TMJ, what it is, how it affects you, how it can affect other aspects of your life, not just your bite and just your dental hygiene. You know, it can affect a lot more. But today I think we're going to kind of hop more into clear aligner. And so I know you have like a couple topics that you want to talk about with that.
Yeah. So there's a lot of clear aligner products on the market right now, and the best one is still Invisalign, and they were the first. Their patents wear off after 20 some years, so it's kind of the wild west out there now. So I think there's literally 30 different companies that have a clear aligner product. Okay. We've tried a few of them, and there's no comparison. So we love Invisalign. It's got the science, it's got the research behind it, it's got the customer service behind it, it's a better patient experience, all kinds of stuff.
I imagine it's the bigger company. Like you just have the more resources. Yeah. They've been around the longest.
They've been around since at least 1999.
Wow. See, me thinking of Invisalign, I'd never think it'd go back that far.
Yeah. I first encountered Invisalign, the first I can remember was in residency in 2001.
Wow. Okay.
So that was a while ago, and that wasn't like day one. Like it was a guy brought in a lecture, and we were listening. So I'm not sure exactly. I want to say around 1999, but they've been around for a while.
That's crazy.
I was literally 1 year old.
Yeah,
I wasn't even thought of.
Yeah, I think they've got over 20 million cases. It might even be more than that. So a lot of science, a lot of engineers, scientists, orthodontists, dentists, all kinds of people working on it over the years, and it's phenomenal. So
I do want to know, I guess, compared to, before we kind of hop into any clear aligner and TMJ and its relation with each other, how would you compare any clear aligner, or I guess we can more specifically talk about Invisalign since it's the most prevalent, against braces? Because I was a braces kid growing up, and I had the bands. I had braces for like 3 years. Honestly, I felt like my dental health wasn't as good because I had braces. Like
it's tough,
especially when you're a middle school kid and like so much like hygiene that you have to keep up with. How is that compared to something like a clear aligner, like braces versus clear aligner?
Yeah, it's better, basically, for one word.
Okay.
There's a lot to it. It is definitely easier. It's better. It's faster. It's more direct. So one thing to kind of keep in mind, generally speaking, when you're using metal, is you're usually using a wire, and that wire is transmitting force to all the teeth on that arch, right? And then there's variations on that and stuff, of course. But the cool thing with Invisalign is you're programming each tooth specifically to move. So actually moving each tooth less with less force.
Okay.
So that's great. You said that what we call the hygiene issue is definitely a huge thing, because it's a lot to have a lot of hardware on there.
And a big part is like a lot of people look to do that at a younger age because your teeth have already shifted a lot. You want to have that, a good smile like at a young age, and then you can kind of keep up with it when you grow.
Yeah.
I know a lot of patients come in like later and they either have braces or Invisalign and they want to fix, what happened later in life too.
Yeah, Invisalign's great for a lot of things, from a full case to just maybe we had some ortho before, we're retweaking things.
So I know you said it's kind of like less, not pain, but I know when I had like braces, right, I would be in like some pain, like especially I had bands in, it's like very like restrictive. Would you say it's like less painful to have Invisalign versus braces?
Much less painful. And then especially for younger people, there's the whole sports thing. So depending on the sport we're talking about, having metal like a contact sport, or even like volleyball or something, that can be a serious issue.
One
you
hits
get
the mouth.
Metal brace on it, you get hit in the mouth, so you don't have to wear that Invisalign. Another nice thing, for all people, I was thinking adults as well, is that you can remove it. So if you want to take family pictures or something like that, you don't have metal in your mouth. So comfort-wise, it's so much better, and convenience-wise.
I imagine it's like more of a confidence thing too. Like a lot of people
Oh,
don't
yeah.
want to show their smile with braces. And
Right.
It's like a stigma, like, you know, I don't feel confident. Like, I don't want people to see me. I got all this metal in my mouth. Don't look. But if you imagine if it's just, you know, like an aligner, you just
especially as a TMJ dentist. So a lot of times I'll have to do orthodontics, like moving teeth, as part of the treatment.
Right.
Well, a lot of my, not all, but probably a big chunk of my patients are 30 plus. Well, it's not the easiest conversation to have with, you know, a 35-year-old, you know, mom who's a teacher, you know, to do metal braces, right?
Yeah.
So
It's kind of a big life change, honestly.
That's a huge win as well. Yeah, definitely.
Okay. Have you ever had a patient come in with like a brace that cut them out and like cut off their lip?
Yeah. You can, with the metal, you can definitely have some stuff happen because it's metal in there. Sometimes, or a more common one is simple, is the wire. So basically with metal, you have actual brackets on the tooth, like a little claw kind of thing, and the wire slots into that, and then you can put other stuff on that. Probably the most common orthodontic emergency is that wire will get loose in the bracket, and so now it's poking, and so that's a serious thing. You know, it's like, yeah, you need to come in. You don't have that with Invisalign. It's so much nicer.
Like the cost difference? Because I remember braces back in the day was like
super
real expensive. Like what is it compared to like an Invisalign or any other clear aligner?
Same thing.
Really?
Same cost, yeah. Because you're paying for a treatment.
Right.
You're paying for a treatment. You're not paying for the mechanism we use to get there. So it's the same. It's just an orthodontic code.
The exact same treatment.
Yeah.
But the method is a whole lot cleaner.
Less work.
Yes.
Okay.
Yeah. It's pretty cool. Yeah. There's even more to it because you can track it. You can watch the teeth move with the patient. You can show the patient, hey, here's where we are. Here's where we're going, because you can show them on the software. Yeah, there's a lot to it. Invisalign is a lot more, at least from the patient's perspective, predictable on when it's going to end.
Okay.
For example, so with Invisalign, you get a series of aligners or trays, and you wear each one for 2 weeks, and it moves the teeth a little bit, then another one. So you may have a case, and it may have, say, 20 aligners in it. That's a bigger case.
Wow.
Well, it's 2 aligners per month. That's 10 months. So you know right off the bat, oh, 10 months from now, I'm going to be done. So that's kind of nice, too. 20, by the way, that's kind of a longer case. I'd say most cases around 9 months, give or take. Depends on the case. They're shorter ones.
Did you say braces work faster than Invisalign?
No, Invisalign works faster.
Really?
Yes. Yeah, because you're moving specifically each thing, very nuanced, exactly where it needs to be.
You get new retainers each time?
What's that?
Because you get new retainers each time?
Right. Yeah. So we have some. So this is our. This is a nice Invisalign box.
Yeah, I was kind of
packaging.
curious how does this whole how does an aligner process work? I've had braces, but I've never had any Invisalign or clear aligner.
Right.
How does it work? Like, what do you do?
So when you come in for the dental appointment, of course, and we do an exam and whatnot, and then what happens is we scan the teeth with a digital scanner, so no more of those impressions, the goopy impressions, and take a bunch of picture of your smile and your teeth and things like that, and that's it for you, for the patient, for that day. You're done. Then on the doctor side, I get a portal, if you will, a software where I'm seeing your teeth and I'm programming exactly how it's going to move, and I get that part done.
Wow.
And then send that off, and that whole thing takes about 2 weeks. 2 weeks from when the patient comes in, and we do the scans and the photos until they actually come back and we have their Invisalign ready to go.
Wow.
It's a pretty.
And so you come in every now and again, and you have to get new, or do they just ship to you? Do you get new aligners, or is it all just one aligner, one process that you just deal with for 9 months to about a year?
So what we do, here's an actual Invisalign aligner. It's very nice, very small. You'll get a series of them. So let's say 12 aligners, and so you're looking at about a 6-month case. And the way we have it set up in my practice is I only see the patient every 3 to 4 months. That means I'm only seeing him 2 times, maybe 3 times the most. So it's real convenient on the patient side also that they don't have to have a lot of times missing work or missing school coming for dental appointments. So it's really nice on that aspect.
Okay. So it's just like you scan the teeth once and it just shows you. That's crazy.
Yeah, back in my day with the braces, you had to do the goop.
Yeah.
Sit in it, and then you would get like the fill for it, I guess.
Yeah.
But it was disgusting.
Yeah,
So,
yeah.
A digital scan sounds a lot better.
Not only that, with Invisalign, with their scanning, you can scan it and get a real-time estimate of what it looks like right there chairside. Like so basically, if your teeth are all kind of shifted and crowded and whatnot, the scanner will do a simulation. I haven't timed it. It's less than a minute, maybe 30 seconds, and you can actually see what it's going to look like. Now, that's before the doctor programs it, but it's about 98% accurate.
You can literally watch literally watch your teeth shift to like the correct position.
Yeah, it's a real.
And like the first appointment.
Wait, it gets better. You can actually do it with a photo. That's really cool. Now you can actually do it with a video. You can video a patient talking for about 30 seconds, scan them, run the simulation, and then play the video back them talking with their teeth straight.
Really?
And it's really eye-opening to people.
That is actually really nuts.
It's pretty cool. Yeah, it's really, really helpful because it can be kind of abstract, you know. It's like, yeah, I know I want my teeth straight, but you don't really see the impact, what it's going to look like.
Yeah.
So it's pretty nice.
Could you have like imagined back in 2001
Is it ever going to get like
that
that?
it would have ever gotten like this?
You know, it's funny. I think. So I graduated dental school in 2000. Dating myself, and I think the only thing I still do exactly the same, or close to exactly the same as I did when I graduated dental school, is probably extractions of teeth. Everything else has changed.
Wow.
Implants, whitening, root canals, tooth color fillings, ortho, TMJ. Virtually everything has changed.
Just over 25 years.
Yeah, I know. It's crazy.
Could you imagine? I guess thinking even more forward, how would you like imagine the dental world changes in another 25 years? Like 2050, how's it looking?
Right. Well, someday we'll just grow your teeth back.
That would be nuts.
No, I'm dead serious. Tissue engineering. Yeah.
Really?
Yeah.
It's
It'll
like
be
actual Marvel stuff.
right. So like, okay, so you have a situation where the tooth is no good. Whatever, it got broken. It's got a big cavity. And unfortunately, that does happen. Sometimes, unfortunately, we have to take the tooth out. All right. Well, currently, if you take the tooth out, your options are do nothing, which is an option, but almost never recommended. You can replace it with probably very commonly a bridge. That means you grind on the 2 teeth around the missing space and make something that cements in there. That's a little aggressive because now you're working on 2 other teeth. You could do something that's removable. Like, that's not real cool. Like, my grandparents had that kind of thing. You could, the state of the art right now is an implant. You know, put an implant in the bone and then put a tooth on. That's fantastic. But in the future, it'll be, oh, well, dear patient, take this blue pill and we'll actually grow your tooth back. And just knowing humans and how we are, there'll probably be a blue pill to grow your tooth back and a red pill to grow a Hollywood tooth back, or something that we wanted to actually change.
Back to the Matrix.
Yeah.
So that'll be cool.
Okay, so you're saying in 25 years, there's a chance that we can take a pill or a treatment and literally grow back a tooth.
Yeah, yeah.
I'm going to log that down.
Yeah, absolutely.
25 years, they're going to look back at this podcast and be like, wait, Dr. Hill was on you knew.
Yes, so we think it's going to take about 2 years for that to happen. From you swallow the pill till the tooth's fully formed.
Oh, wow.
By the way, in nature, it takes about 9 years. So in actual tooth, not to get too far in embryology and all this kind of stuff, but when the cells come together, it's called something called a tooth bud, and it starts forming in the bone, and then it has to start to form, look like a tooth, and it starts to get towards the gum line, eventually comes in. Anyways, that whole process from start to finish is depends on the tooth, but it's about 9 years on average. So that,
like an
nature,
adult tooth, right?
Yeah, it takes a long time. We think we can get it to around 2 years. That's what the current research and science is doing right now.
I'm really having such a hard time even wrapping my head around that.
Because crocodiles do that, right? Or
so, yeah, there are certain Sharks are also famous for that too. There are certain animal sets that generate many sets of teeth. Yeah.
That's crazy.
I literally had no idea about that.
Yeah. But now their
That's
jaws
crazy.
are very different, but that's for another day.
Okay.
It's very interesting. Why humans can't do that, and because we walk upright, and there's a whole bunch of stuff with that.
Really?
Okay.
Yeah.
Huh.
Yeah.
Well, I did want to ask, since we are on the topic of clear aligner, how does that quite fit in with TMJ? So obviously you're fixing your mouth, you might be fixing your bite a little bit.
Right.
What is like the benefit of using something like Invisalign or any clear aligner
Right.
that might help affect like your TMJ either in a positive way, or I guess how are they like linked together in that world?
Right. So with TMJ treatment, the treatment that's probably most standard is an actual appliance or type of appliance, and that's probably a subject for a different podcast.
Mm-hmm.
Because of the changes in Invisalign specifically, another reason I love them, and specifically really in the last few years because of the things it can do. It's always changing and growing, evolving. I can use Invisalign on certain TMJ cases. Actually quite a few, the vast majority now. I can actually use Invisalign to treat TMJ.
Okay.
Little caveat there now, Invisalign doesn't fix TMJ by itself. Like when the doctor submits an Invisalign case, there's not a big red TMJ easy button to hit for it to work like that. It's because of the TMJ training that I have that I can use it. And so there's a lot of, so for the patients that it would work for, that is using Invisalign for the TMJ, there's a lot of benefits to it. One right off the bat is, hey, we're straightening your teeth and fixing your smile as we're going along.
Yeah.
People love that. They also love we talked about a little bit earlier, the definitive part of it. Mrs. Smith, your
Same
case is
timeframe.
14 aligners. It's going to be 7 months. So
Right.
mentally, it's a real nice thing I've noticed for people. Two, sometimes TMJ treatment can feel a little abstract. Like, I'm wearing this thing and it helps me feel better, versus if I'm using Invisalign, it's a lot more specific and definitive. Oh, I see my teeth straightening. I see this process happening.
You can just link it to just automatically kind of feeling better. It's more of like in your mind, like I can literally see, I'm seeing the progress. I know I'm feeling better because I can see it.
Exactly.
Fixing.
Exactly. Yes, absolutely. Yeah, yes, I think that's well said.
Okay.
Yeah.
Would you say an aligner is the best aid to help TMJ?
Say that again?
Would you say that an aligner is the best aid to help TMJ?
It depends on the case. It depends on the case. If Invisalign is an option, it definitely is. It definitely is. And some of the way that the Invisalign can move the teeth now, a lot of the things it can do is one big thing. For example, we were talking about children earlier. So a pretty common experience is that, especially for a child, is sometimes they'll need something called a palatal expander. Like their upper arch needs to be wider. Wow. And so put it in, and it's on the roof of the mouth, and you can't talk very well with it, and then mom has to change it every night, and it's a big ordeal for the whole family. You don't need those anymore. You can actually do it with Invisalign.
Really?
Yeah, like that's one of the things. So back to the TMJ, the functionality of the Invisalign, the power of the Invisalign now is it can do a lot of certain movements and setting things up in a certain way that was not possible. When I started TMJ treatment in 2007, a few years ago, I would do a case, and if ortho was involved, like if part of the solution for fixing someone was, okay, we're going to at some point need to move your teeth around, the only option was metal. And again, if it's an adult patient, that's a hard conversation.
Yeah.
So the nice thing with Invisalign is, we can avoid that, obviously. And I lost track on our question here.
Well, I guess I want to ask, like, it's not just like, okay, with Invisalign, we're trying to help treat it's not just, I guess, targeting some issues with TMJ. It's actually like kind of fixing it in a way. And it's also just like mentally.
Right. We're fixing the root.
Psychological standpoint, making you feel better.
Yeah, we're fixing the root cause of what's causing it.
Okay.
So it's a great thing, yeah.
Okay.
Okay.
So, dealing with TMJ, go and get Go and get Invisalign.
Go and get looked at.
Go and get you your local clear aligner. Get your teeth straight. Don't get metal in your mouth.
Yeah.
Love it.
Good to know. All right. Well, I mean, yeah, I think we're definitely wrapping up here with the Clear Aligner TMJ podcast. Thank you, Dr. Hill, for joining us today. I think we had a pretty good little session today.
Yeah.
We learned a lot. And looking forward to the next edition. I think we're going to have a lot to talk about in the next one. So.
Looking forward to it. All right,
Thank you.
guys. Good job.